Welcome to Variations 4. The immune system is the unit we're on. Specifically, it's talking about HIV, AIDS, and HIV. In this video, we'll cover questions 1 to 4. Number 1, the 3 variables impacting HIV transmission. We can look to map number 1. And see that the 3 factors are, and probably the biggest factor is contact with body fluids. Other factors that are related is how virulent is the patient who, or the person who is currently hosting the virus. So if you have bodily contact with the fluids, bodily fluids, contact with bodily fluids from someone else, how high was their virulence is the question. Was their HIV virus levels high in their blood or was it low? That's going to have a factor determining infection as well. And then, of course, what is the status of the person being infected? Is their immune system strong? Is it weak? Again, probably the biggest single determining factor, the single biggest way to avoid it is to avoid contact with bodily fluids. Number 2, what is the window period? How long is it for HIV? The window period is the time before an infection is detectable and or before signs and symptoms become apparent. The window period for HIV is somewhere between 3 weeks and 3 months. Question number 3, what is meant by CD4 count? First, an explanation here, and then we'll look at a picture. So T cells have the CD4 receptors on them. So they have the greatest number of CD4 receptors. And so when we talk about CD4 count, in essence, we're talking about T cells, which are important cells in the immune response. Which is why when you have a really low CD4 count, what you're really saying is you have a low T cell count, which makes the host, the person, susceptible to opportunistic infections. And the whole point of antiretrovirals is to decrease viral load, so CD4 count remains high and the body's defenses remain high. So if we just look at a picture here, you can see that what we're looking at here is, here's a T cell, and here are the CD4 receptors. And the virus just joins itself to those receptors. The HIV virus joins itself to the CD4 receptors. Okay, question number 4 is, John has a CD4 count of 600. Explain his HIV/AIDS status. In essence, what this paragraph is saying here is that when your CD4 count drops below 200, you're considered to be AIDS, of AIDS status, and I guess the reason for that is your T cell count is so low that you're susceptible to opportunistic infections and acquired immunodeficiency syndrome, which is what AIDS stands for. So if someone has always remained above 200 in terms of CD4 count, they're considered HIV positive. If they've ever dropped below 200, they're considered to be an AIDS patient.